The rehabilitation of post-operative patients is important in nursing care. Surgical procedures often leave patients in a vulnerable state regardless of how complicated the procedures are. They need a high level of care, compassion, and clinical knowledge. The dynamics of patients' recovery have been proven to be influenced by a number of factors, including the standard of nursing care. Good day to each and every one of you. I am Joanne Gonzales, and together with me are Paj Guliman, Ariana Holly, and Iven Ignacio, presenting a nursing research study entitled Lived Experience of Patients to Post-Surgery Nursing Care. The purpose of this study was to explore the lived experiences of patients post-op. With this, patients are able to evaluate the care that they received and how it affects their overall well-being.
Now we have the methods. The researchers utilized the phenomenological approach, qualitative research design, to explore the lived experiences of patients post-surgery.
Participants. The study focused on 8 post-operative patients from Negros Occidental selected for purposive sampling, a non-probability method chosen for its alignment with the study's goals. The selection process was based on specific inclusion criteria with R. First, individuals must have undergone surgery. Second, those who received surgery from February 2024 to April 2024. And third, they can either be male or female. The following are the exclusion criteria. First, individuals who have not undergone surgery. Second, those who received surgery before February 2024.
For the research instrument, this interview was conducted using an interview guide made by the researchers. The interview guide consisted of two main parts. The first part covered the demographic profile of the participants, which included their age, sex, educational attainment, and duration of hospital stay. For the second part, the participants answered a set of questions that focused on their lived experiences as patients in the post-surgery phase receiving nursing care. Now let us proceed with the results. For the theme 1, it shows the statements from the participants that depicted their experiences with the quality care of nurses they received post-surgery. In this theme, the perceptions of the participants of the overall quality of nursing care they received post-surgery, including aspects such as attentiveness, responsiveness to needs, and competence of nursing staff, are explored. This theme aligns to the Lydia Hall's theory, where the core focuses on the patient as a central figure, emphasizing the importance of understanding and addressing individual needs and experiences. With the nurse practices patient-centered care, this positively impacts the recovery of the patients and ensure nursing intervention that meet the needs of every patient. Max, one of the participants, expressed his satisfaction with the nurses responding to his urgent needs. According to WellAce 2020, patient perception of staff responsiveness during hospitalization can have a direct influence on revenue. As what mentioned by Day, also one of the participants, on how competent the nurses are and that they are good, these statements shows that the competency and skills of the nurse have an impact on the satisfaction and recovery of their patients.
Theme 2, Table 3 presents participant significant statement regarding post-surgery communication and information. Effective communication in healthcare, as highlighted by Edugo Ferreira 2024, is crucial for optimal patients' outcomes. However, our study found challenges in post-surgery communication echoing concerns raised in research by El Mediani et al. 2023. Nurses play a critical role in providing post-surgery instructions, yet some participants reported a lack of clarity in the instructions they received. Addressing these communications challenges is essential for improving patient care and surgical outcomes. In Hall's care core and cure theory, the care aspects focuses on the nurturing relationship between nurses and patients. Seen in clear post-surgery instructions, the core aspects emphasizes the therapeutic relationship and patient's active role, fostered by effective communication and information for recovery. The care aspects involve the medical and technical aspects of care, where clear instructions ensure adherence to treatment plans and prevent complications. Effective post-surgery communication addresses care and core by nurturing relationship and empowering patients while also enhancing care by ensuring compliance, leading to better health outcomes.
Patients' perceptions on pain management effectiveness and communication by nursing staff. Most patients mentioned receiving prompt pain medication following their operations and guidance on effective pain management. Most patients reported receiving prompt pain medication after surgery and when needed, with nurses offering guidance on pain management. However, one patient, Almond, had a unique experience where she requested the transfer of a dextrose line due to discomfort. Despite her initial complaint, the nurse promptly addressed her concerns with kindness, providing comfort and easing her pain. These statements from the patients align closely with the Hall's core care and cure theory, which emphasizes a holistic approach to patient care. The perceptions of the patient of the efficacy of pain management interventions administered by nursing staff and their experiences regarding how nurses communicate about assessment and management directly related to existential and spiritual needs of patients, the nurturing and supportive aspects of patient care, and the medical and technical aspects of care. These insights inform holistic approaches to pain management that prioritize not only the alleviation of physical pain but also the provision of compassionate care and support to address the broader needs of patients experiencing pain.
Lastly, we have theme number 4. Theme number 4 explored the recommendations received from participants for enhancing the delivery of nursing care, including aspects of patient-centered care approaches and communication strategies. Patients appreciate nurses who are skilled with their work, but also have a nice personality, which leads to better nurse-patient relationships. Moreover, they also appreciate nurses who communicate efficiently with them. This connection ultimately enhances patient satisfaction and health results.
Conclusion. The study explored the lived experiences of post-operative patients, emphasizing the vital role of high-quality nursing care in patients' outcome and satisfactions. Key findings include the value of nurses who are attentive, responsive, and competent in managing wounds, medications, and vital signs. Effective communication, providing clear instructions and addressing patient concerns were significant for positive experiences, fostering trust and understanding. Pain management was also vital, with time intervention enhancing patients' comfort. Patients recommended that nurses adopt a friendly, approachable demeanor and practice empathetic communication to improve care quality, emphasizing patient-centered approaches and continuous professional development for nurses can lead to better patient satisfactions, fast recoveries, and reduced readmission rates.
Now let us move on to our recommendation. For hospital administrators, it is recommended that they provide comprehensive professional development programs, workshops, and training sessions for the nurses to enhance their skills, emotional intelligence, communication skills, and further develop positive nurse patient relationships. For nursing school administrators and clinical instructors, it is recommended to include patient centered care concepts, effective communication strategies, and a focus on competence, attentiveness, and responsiveness in their lessons. For nurses, to establish patient centered approach by improving nurse patient relationships through active listening, acknowledging patients' concerns, and involving them in the decision making process. For the post-operative patients, be active in the recovery process by asking questions, sharing their concerns, and engaging in an honest and open communication with their healthcare providers. For student nurses, they should continue to develop and hone their skills in caring for post-operative patients and managing their pain, whether pharmacological or non-pharmacological means. For future researchers, consider including quantitative measures to survey patient satisfaction and should consider the type of surgery the patient received, for this could be a contributing factor on how nurses give their care.
Scan the QR code to access the references used in the study. This ends our presentation. Thank you for watching.